Hi there, my name is Timmerie Basher with Muscle Resolution. I wanted to take just a few minutes today and explain a little bit more about muscle therapy. I primarily use a modality that stems from applied kinesiology. How about we take a closer look? The level of individualized care and attention begins the minute someone walks in. I like to talk with the client about what is bothering them, in addition to any past injuries and surgeries. After a detailed discussion, I look at how the body moves to address limits in range of motion. The combination of what I see in the body and what the client tells me gives me a deeper understanding of what may be happening and where the muscular imbalance may be located. Our bodies are much like a puzzle, and everybody's puzzle is put together very different. While two people might come in with the same pain, the source of that imbalance might look very different. I work with the client fully clothed, which reduces any feelings of discomfort that they may have if they were disrobed. While laying on the table, I address the limited range of motion that I see by testing various muscles and planes of motion. We cannot truly isolate a muscle, but we can emphasize given muscles based on different positions. My objective is to elicit a stronger feedback loop between the nervous system and the muscular system. Essentially, I'm much like an electrician. I try to get the nervous system to communicate better with the muscular system. This is done with various isometrics, in addition to working with the origin and insertion sites of the muscles. In other words, where the muscle connects to the bone. After completing a session, I always like to check in with the client and see how they're feeling. While some people might feel energized and rejuvenated, other people might not notice a difference right away. Sometimes people might feel tired or a little sore. The muscle therapy and training that I do is fantastic for a variety of individuals. It is extremely valuable for people coming out of post-surgery who are looking to recover and recuperate that much faster from their injury. It is also beneficial for both your athletes and your non-athletes alike. Ideally, it's good for anybody looking to balance their muscular system, to reduce compensation patterns, to increase their longevity in life, to feel better. It is my huge belief that if we move better, we live better with confidence. I want to take another few minutes and check in with a few of my clients so you can hear from them how this practice has benefited and served them in their lives.
So I've seen Timmerie twice, and what she's done for me is she tests my muscles and finds out which muscle is not doing its job correctly.
I began having problems with my right shoulder as I was going to the gym a lot, and I was overcompensating with my bicep.
I came to her with horrific neck pain, back pain that I've had for years. Whenever I exercise, it would trigger. When I worked at the computer, it would trigger. I have migraines constantly.
When she finds that muscle, you can tell that that is the one that needs some love.
And I ended up straining a tendon to where I was losing strength.
I don't know what she does. I think she levitates on her thumbs when she's working on me. After my first session with her, actually saw 2-3 weeks without a migraine, which for me was amazing.
And then she gives that muscle some attention and then retests the muscle to make sure that it is working properly again, so that my other muscles don't have to work as hard as they were before to make up for that muscle not working.
I'd probably see Timmerie once a month for normal wear and tear.
I just know it makes me feel better, and that's that.
It was something I definitely would recommend to anybody.
She's very good about making sure that it's the right solution for you. So don't be intimidated. Come in and